I did want to perhaps get everybody's feedback on there's one thing that you could do, that you could think about improving risk communication. What would that be?
Send everybody who has to talk to patients and their families about this on a properly accredited course.
This I wanted to say too.
Yeah, excellent.
That's it.
Consensus.
Me too, and I'd like to add to it that whatever the take-home information is should be easy to use, easy to read, easy to understand.
Well, I would say give more guidance to people who are at high risk or have a predisposition to cope with it, to bring it in their family and monitor it a little bit better. And there is also a role for advocacy groups, because we give conferences with neutral information from healthcare professionals, and they interact with the public. They ask questions, and I think that is a good idea.
I feel very strongly that the information that's given is so clear that people do understand that even if they have prophylactic surgery, that they still can get breast cancer. Because I think there are a lot of people who don't know this.
Yeah.
For me, deciding what patients want isn't always necessarily what healthcare professionals and researchers think they want. And I think I've learned over the last few years of my research is that when a patient is experiencing a diagnosis of breast cancer or thinking about their family history of cancer, what is really most useful is, in plain language, the answers to questions like, what is it like to tell my child I have breast cancer? What is it like to go for a genetic test? What is it like to put together a pedigree? What is it like to do such and such? And I think for me the future is getting some of those stories online, onto websites where people can click on and they can just hear a story from another patient somewhere around the world to see what is it like to. That would be the most important thing for me.
Fantastic. Thanks very much to all our participants for taking part in this roundtable discussion. And I know it's been quite difficult for some because, of course, a lot of people here are talking in a language that isn't their first tongue. So, again, thank you very much for taking part. It's been absolutely wonderful hearing your views. And hopefully now this will go online and we'll be able to get further debate from people around the world who will be able to access this information, sort of following on from some of the comments that Rachel made.